Good afternoon. Bonjour à tous et à toutes. Dr. the Honorable Kailash Kumar, Minister of Health and Wellness of Mauritius, dear partners, the Merck Foundation alumni, and future healthcare experts of Mauritius. I joined Russia to thank you for being with us here today. I'm also very, very happy because this is my first time visiting Mauritius, this beautiful island, and I'm even happier to be doing that to celebrate the initiatives of the Merck Foundation and, of course, to celebrate your success. We are also very pleased having met this morning His Excellency the President of Mauritius, and we have been discussing with him the impact that the Merck Foundation programs are making on the public sector, mainly on the public health sector, with a special focus on the new public cancer care hospital and the IVF Centre, which is the first private center that is going to be open here in Mauritius with the support of the Merck Foundation, and also to discuss the future impact, your future impact on patient care in general. It has been a very interesting discussion, and the Minister had been raising and discussing and sharing with us, the President has been sharing with us the priorities that he has in healthcare, and we have been able to confirm how much commonalities do we have when it comes to the healthcare agenda and the initiatives of the Merck Foundation here in Mauritius. So, as you all know, because you are familiar with the activities of the Merck Foundation, the Foundation started the partnership with Mauritius Government and Ministry of Health and Wellness in 2017, so 6 years ago. And since then, our joint programs have been developing with what I consider to be huge success, thanks to the continued support of the Honorable Minister of Health and Wellness of Mauritius. Ladies and gentlemen, I am very, very proud to know that the Merck Foundation has provided, since 2017, 73 scholarships here in Mauritius. We have said that also to the President this morning, of 1-year online postgraduate diploma and 2-year master degree for Mauritian doctors in many underserved and critical medical specialties as fertility, embryology, sexual and reproductive care, oncology, very important, cardiovascular prevention, diabetes, endocrinology, gastroenterology, dermatology. I have been quite impressed of reading that we have been supporting almost each and every specialty, medical specialty that exists in the world, with focus on aging population, but also, and importantly, prevention of diseases, multiple diseases, and also taking care of neonatal medicine, mental health, which is also a priority here in Mauritius, family medicine, and many more. And importantly, the objective of our joint program is to contribute to building healthcare capacity in the public sector. And this is with the objective to establish a very strong platform of skilled and specialized healthcare providers across Mauritius. We strongly believe that empowering people will lead to a better future. We also believe that good healthcare can transform the lives of individuals and families across developing countries, and it can significantly contribute to economic and social development because, of course, healthcare is a major driver of economic growth and, consequently, of social progress. We all know that the lack of financial resources is not the only challenge in Africa, but the scarcity of trained healthcare professionals who are capable to address diseases, prevention of diseases, diagnosis and management at all levels of the healthcare system is the biggest challenge. A sweeping shortage of medical and healthcare manpower has been a key limiting factor. In the WHO 2017 report, Africa had just 168 medical schools in the entire continent. Just one medical school in 24 countries, and no medical school in 11 countries. Sub-Saharan Africa, excuse me, with 24% of the world's disease burden, has only 2.8 healthcare workers per 10,000 capita. And this is compounded by the maldistribution of workforce among urban and rural areas and the public and private sector. For example, before the start of the Merck Foundation programs, there was not a single oncologist, fertility or reproductive care specialty, diabetologist, respiratory or intensive care specialist in many countries in Africa, such as the Gambia, Liberia, Sierra Leone, Central African Republic, many others. And this was limited, specialized doctors, that was limited but the lacking a specialized doctor in many critical fields. And with a tremendous visionary strategy, the Merck Foundation has focused on building capacity in those countries by providing scholarships for the first specialist and specialized team in many of these fields, medical fields that I have mentioned. Moreover, infectious diseases and malnutrition have been two of the most popular agendas that have dominated the global health discourse on the developing world ever since the advent of global health cooperation. With the epidemiological transition in developing countries in recent decades and the emergence of chronic non-communicable diseases such as cardiovascular, hypertension, diabetes, and cancer as very significant public health problem, increasing attention has been accorded to combating the double burden of communicable and non-communicable diseases, sometimes called the triple burden, after adding injuries and degenerative conditions. The relative shares differ considerably across the developing world. For instance, non-communicable diseases are now the overall leading cause of mortality and morbidity in developing countries, having now exceeded infectious diseases. Therefore, together with local partners in many countries in Africa, the Merck Foundation continues their efforts in transforming the patient landscape through all these scholarship programs. Till today, I'm very proud to say and to congratulate the CEO of the Merck Foundation that for more than 700 scholarships that have been provided for young doctors in 50 countries, in 42 critical and underserved medical specialists. This is a pioneering program, which we are very proud of. Many of them are becoming the first specialists in their countries. Example in Liberia, the Gambia, Burundi, Malawi, Sierra Leone, Zambia, Zimbabwe, Guinea, Ethiopia, Congo, Nepal, Bangladesh, and more. Dear partners and alumni, last but not least, I'm very glad to meet you today, to hear from all of you, to receive your feedback, to hear your success stories, and most importantly, to hear your experiences, that the one that you have gained from these scholarships, because we need to continue to understand what else can we do better and how can we maximize the success of these training programs. I congratulate you all. I know many of you have already graduated and the rest are undergoing all their scholarship very successfully. We are very happy to see the interest that our scholarship programs have generated because this is the beginning of a process that will significantly contribute towards your future career and towards the quality of your practice, and hence will further contribute to improving patient access equitably and of high quality in your country nationwide. So I praise that we continue to work together to transform the patient landscape here in Mauritius and across the African continent, and I am looking forward to meeting you again after the rest of your graduate to celebrate your success stories. Once again, congratulations to all of you for having placed your time and efforts into advancing and furthering your careers in any of the specialties that you have practicing already. I want to take this opportunity to also recognize our partnership with the Ministry of Health, and of course I want to say that as a member of the Board of Trustees of the Merck Foundation and as the CEO of the company, a company which is family-owned, which has been in business and exercising these values at all levels, I am extremely proud of what has been done by the Merck Foundation. I was an early sponsor of More Than a Mother, so anytime that the program is mentioned, I really jump full of pride. I know everything that Rasha, with a very small team, has done and the impact that she is creating in the company. I always present the Merck Foundation and Rasha in particular as a leader, as a role model of what we call high impact culture in the company. And once again, being here today and listening to all your testimonial has been extremely inspiring for me, and most importantly, a catalyst and a recognition that we are doing the right thing and that we will continue to invest in all these initiatives that have so much impact in the society and in the different communities in which we operate. Thank you very, very much, and let's enjoy the evening together.